Quetiapine is a second generation of atypical antipsychotic used to treat schizophrenia, bipolar disorder, and depression. Quetiapine is thought to work by helping to restore the balance of certain chemical messages or neurotransmitters in the brain, which improves mood, thinking, and behavior. It mainly works by blocking the receptors of two neurotransmitters called serotonin and dopamine. Serotonin is involved in a range of functions in your body and acts as a natural mood stabilizer. Not having enough serotonin is thought to contribute to depression, anxiety, and mania. Dopamine also plays a number of roles and is involved in mood, behavior, sleep, and more. Not having enough dopamine may contribute to feeling unhappy, unmotivated, mood swings, sleep problems, and other symptoms. What is Quetiapine used for? Quetiapine tablets and extended-release tablets are used to treat schizophrenia in people 13 years of age and older. Bipolar disorder in adults, including depressive episodes associated with bipolar disorder, manic episodes associated with bipolar disorder alone or with lithium or valproax, long-term treatment of bipolar disorder with lithium or valproax, manic episodes associated with bipolar disorder in children aged 10 to 17 years old. Quetiapine extended-release tablets are also used to treat major depressive disorder as set on treatment with antidepressant medicines when a healthcare provider determines that one antidepressant alone is not enough to treat your depression. It is not known if Quetiapine is safe and effective on children under 10 years of age. How should I take Quetiapine? Take exactly as your healthcare provider tells you to take it. Do not change the dose yourself. Take by mouth, with or without food. If you take an extended-release tablet version of Quetiapine, it should be swallowed whole and not split, crushed, or chewed. If you feel you need to stop this medication, talk with your healthcare provider first. If you suddenly stop taking Quetiapine, you may have side effects such as trouble sleeping or trouble staying asleep, insomnia, nausea, and vomiting. Quetiapine tablets, schizophrenia in adults, initial dose 25 mg twice daily. Recommended dose 150 to 750 mg per day. Schizophrenia in adolescents 13 to 17 years. Initial dose 25 mg twice daily. Recommended dose 400 to 800 mg per day. Bipolar mania in adults. Monotherapy or as an adjunct to lithium or valproax. Initial dose 50 mg twice daily. Recommended dose 400 to 800 mg per day. Bipolar mania in children and adolescents 10 to 17 years. Monotherapy, initial dose 25 mg twice daily. Recommended dose 400 to 600 mg per day. Bipolar depression in adults, initial dose 15 mg once daily at bedtime. Recommended dose 300 mg per day. Quetiapine extended-release tablets. Schizophrenia in adults, initial dose 300 mg per day. Recommended dose 400 to 800 mg per day. Schizophrenia in adolescents 13 to 17 years. Initial dose 50 mg per day. Recommended dose 400 to 800 mg per day. Bipolar disorder, manic or mixed in adults. Acute monotherapy or adjunct to lithium or valproax. Initial dose 300 mg per day. Recommended dose 400 to 800 mg per day. Bipolar disorder, manic in children and adolescents 10 to 17 years. Acute monotherapy, initial dose 50 mg per day. Recommended dose 400 to 600 mg per day. Bipolar disorder, depressive episodes in adults. Initial dose 50 mg per day. Recommended dose 300 mg per day. Major depressive disorder in adults, adjunctive therapy with antidepressant. Initial dose 50 mg per day. Recommended dose 150 mg to 300 mg per day. Contraindications: hypersensitivity to Quetiapine or to any excipients. Interactions: tell the healthcare provider about all the medicines that you take or recently have taken, including prescription medicines, over-the-counter medicines, herbal supplements, and vitamins. Quetiapine and other medicines may affect each other, causing serious side effects. Tell your healthcare provider if you are having a urine drug screen, because this medication may affect your test result. Tell those giving the test that you are taking Quetiapine. What are the side effects of Quetiapine? Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Report any new or worsening symptoms to a doctor, such as motor or behavior changes, anxiety, panic attacks, trouble sleeping, or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive mentally or physically, more depressed, or have thoughts about suicide or hurting yourself. Call your doctor at once if you have uncontrolled muscle movements in your face, chewing, lip smacking, frowning, tongue movement, blinking or eye movement, mask-like appearance of the face, trouble swallowing, problems with speech, a lightheaded feeling like you might pass out, severe constipation, painful or difficult urination, blurred vision, tunnel vision, eye pain or seeing halos around lights, severe nervous system reaction, very stiff rigid muscles, high fever, sweating, confusion, fast or uneven heartbeats, tremors, fainting, high blood sugar, increased thirst, increased urination, dry mouth, vertebral further, or low white blood cell counts, fever, chills, mouth sores, skin sores, sore throat, cough, trouble breathing, feeling lightheaded. Common side effects may include speech problems, dizziness, drowsiness, tiredness, lack of energy, fast heartbeat, stuffy nose, increased appetite, weight gain, upset stomach, vomiting, constipation, dry mouth or problems moving.